opposed to doing a full surgery.
Correct.
So tell us a little bit about it.
So as we were talking about earlier, basically people who have arthritis, it's when the cartilage on the end of the bone wears down. And when that cartilage wears down, we used to think that the cartilage was the cause of the pain, but it's actually the underlying bone that's the cause of the pain. So people get these bone marrow lesions, which we can only diagnose on an MRI. So on the MRI, the bone would be black, and we'd see this white area here. And if you look at it under a microscope, because a lot of research has been done on this, it looks just like a stress fracture. So bone has millions of pressure-sensitive nerve fibers in it, and when you get a stress fracture, it hurts. So this is kind of a specialized form of a stress fracture, but no one really knew what to do with it in the past. So Dr. Sharkey, who's actually in Philadelphia, but he's from Fulton, New York originally, he kind of thought up this procedure, and then 10 researchers from MIT came up with this product, this calcium phosphate bone substitute that we inject in, that Jeremy mixed up on the show. And the bone is made out of calcium and phosphate, and so what we're trying to do is we're trying to basically fill in the soft spot where the stress fracture is with new bone. So this artificial bone, it comes as a powder, and he mixed it up, and you can kind of see it almost looks like a toothpaste consistency.
Like toothpaste.
So it's able to be injected through one of these hollow drills. So we're able to drill this into the bone, and I'm not going to inject it into this right here because this is a model, but where that soft spot is, we're able to, in the operating room, we're able to inject it in using a live x-ray and make sure we get it in the right spot. So you can kind of see as we inject this stuff, you're going to see it come out of the holes here.
And for those of you maybe watching at home or online on Facebook, what we're talking about is a new way to treat knee pain, whether it's through arthritis, right? This is a new procedure, or newer procedure. And if you have any questions for Dr. Pietropaoli, please send them in, and we will answer them live as he's sort of doing these demonstrations. I just want to remind our viewers so that they know what we're talking about here.
And it's kind of like the knee replacement has gone out the window, and this is called knee repair, because you're just, you know, you're not even really cutting open anything, really. You're just kind of drilling those holes in and sticking the...
Right, just do little small incisions. So
here's my question. I asked you this on the air or off the air because I've had knee surgery, right? So I said, what's the difference between having arthroscopic surgery and having something like this versus having a total replacement?
Exactly, that's a great question. So with a total replacement, we're not cutting the whole knee out, we're actually replacing the ends of it. So we're cutting the ends of the bone off, and we're putting a metal and plastic implant in there. So this is actually a real knee replacement implant,
so
if you want to see.
So you walk around with metal and plastic
You do. You go off in the airport.
Yeah, exactly.
It's
you have to have a special card. It's a good surgery. It's a very good surgery. I still perform knee replacements, but not everybody is a candidate for a knee replacement, or not everybody wants one, or certain people aren't, you know, quote, old enough yet. So this is a nice procedure for people who don't have severe arthritis that's bad enough for a knee replacement yet they're in pain, in a regular, you know, quote unquote arthroscopy where we just go in there and quote clean things up won't do the trick, because the problem is in the bone, it's not in the joint so much. So we're able to take care of the problem in the bone, whereas in the past all we could do arthroscopically was just smooth things over, and it didn't really take care of the underlying problem, which was actually in the bone.
Now we will get to you two in a moment. We have a couple questions on Facebook. People are asking how long the recovery time is.
I'll let these guys answer that question.
Beth or Gail? You go first.
Well, you're back fully within a couple weeks.
Okay.
Couple weeks. You had both knees done too, right?
Yes.
Both
Not at the same time though, one first and then
No, I
the
had
other.
one in 14 and one last year.
Okay.
September 17.
Beth, recovery time for you, same thing?
I was walking on it the next day in PT, and by October, a couple months, I was back to Zumba.
Because you said August, you had it August, and then by October you had were already walking on it.
I was walking on it the next day, but by October I was back to my full exercise routine, which is like Zumba. So that's really hard on your feet.
And before we get to the insurance, which is what I was talking to you about earlier, I just want to know the pain. Is it painful? I mean, I've already talked to you guys about this, and there's two different pain levels going on here. So tell us about your pain, and then we can talk about Gail's pain.
I don't remember that really being painful. The bone calcification was more painful than the actual bone, the injection of that, the treatment.
So afterwards, you were, what would you say on pain? You know how they go pain scale 1 to 10. The day after, what was your pain level?
being on pain meds, probably.
5-0.
It is.
No, I really, I gotta
Right.
say, I might have taken pain meds for a day, and then that was it.
Okay, yeah.
That
Now,
was it.
Gail, my
it was
friend
great.
Gail here.
Well, being a man, we're a lot weaker when it comes to pain.
There's some truth to that, actually.
It was a day of severe pain.
Okay.
You know, and then after that, it was manageable with pain medication.
So
Yeah.
I've never had the procedure done myself. I've had an arthroscopy done.
Okay.
And so basically I tell patients that they may have some significant pain for 3 days, because what we're doing is we're injecting this into the bone, and bone is hard. So when we inject it in there, it builds up some pressure, and it takes a few days for that pressure to dissipate. So it can be, you can have significant pain for even up to 3 days. It's not as bad as a knee replacement pain,
Right.
Yeah,
but
that's
it's more than with a regular knee scope. Now, having said that, probably women more than men don't have as much pain as the men. That's true most of the time. But some people say I don't have any pain the next day, but most people do. And it's going to take a couple weeks for that pain and swelling to kind of go down. And then I tell patients it's going to take about 6 to 8 weeks to get back to full duty type activities
Okay.
versus a knee replacement, which is 4 to 6 months.
Wow,
Yeah,
yeah.
that's a long time.
Not that knee replacements are bad again, but again, the recovery is a lot longer. Some people want to keep working. They don't want to be out of work so long. And this is a nice alternative to either buy them more time, or maybe, you know, some of these patients, they don't even have any significant cartilage damage yet, so we're able to almost prevent or cure their arthritis.
Wow.
Now, does insurance cover this procedure?
Yeah, I mean, everybody's insurance is different.
Okay.
So, but in general, it does cover it,
Okay.
yes.
Okay.
Yeah, because this
Yeah,
sounds
they
like
covered- they
something that
covered
you
your-
need
they
your
covered
insurance
yours.
to pay for. This sounds a
Yeah,
little,
no,
a little
absolutely.
pricey.
We check ahead of time with the insurance, and we let the patient know, because I mean, some people have high deductibles; they have to pay
Yeah.
a lot out of pocket.
Yeah.
Other people have nothing out of pocket. So there's so many different insurances, but in general, they pay for it.
Yeah.
You know, you
Or
said
part
when
of
you
it, at
do a
least.
full knee replacement that you sort of you replace it and it's good for like 10 to 15 years,
15
right?
to 15 to
Or
20
15 to
probably,
20.
yeah.
Excuse, you're the doctor. You
No.
know better than I do. Sorry. But in terms of something like this with the procedure where you're injecting, right? How long can that last, or is it meant to last?
Yeah,
A
that's
lifetime?
a great question too. So when we inject it in there, it hardens just like your own bone, and it fills in the area, and then your own bone fills it in. So the idea is hopefully it lasts forever, as far as the actual it gets replaced by your own bone. But as far as symptoms go, this procedure's been around about 10 years. I mean, knee and hip replacements, they've been around 40, 50 years. So we have a lot more long-term results on replacements. We have 10-year results on this. I've been performing the procedure for 4 years myself. People do get improvement for 7, 8, 9 years. We're finding people even 10 years who were some of the originals. Having said that, I would say I've done about 200 of these procedures over the last 4 years, and we've had 8 patients go on to need a knee replacement afterwards. So it's not that many,
Yeah.
but if you do need a knee replacement, it's not a big deal, because all we're injecting a biologic substance. So it looks just like bone. It looks just like bone under a microscope. So if we have to ever do a knee replacement, we just can cut through it just like bone, like we normally would, and it doesn't affect the procedure. So even if you play devil's advocate and say the surgery doesn't work at all, this surgery, which most people it does work on, but if it didn't, you didn't burn any bridges, you can still get a knee replacement. But most people, it buys them quite a bit of time, and these guys are still doing well after 4 years and a year.
4 years. Okay. And what about you, Beth?
It'll be just a year.
Just a year.
That's a 96% success rate.
Yeah.
If
Oh,
my
you did
math is
good-
right.
good
I don't
math.
know.
Yeah.
Good math.
Okay, but you don't only do it on knees, right? Because we have some other limbs here. This looks like a what? A wrist? I'm guessing. I don't know.
That's a shoulder
Oh,
right
this
there.
is a shoulder.
So that's okay.
Oh, boy.
It's only part of a shoulder. So
oh, I was gonna say
it's
it's
the
a little
actual,
shoulder. My shoulder's bigger than that, and I'm little.
yeah. So it's just the ball part of the ball and
Okay.
socket. But it can be used on shoulders. I have a couple shoulders I'm going to be doing over the next month or two. Foot and ankle, it's very common
Okay.
in. I don't do a lot of foot and ankle surgery, but I have done 2 patients who had arthritis in their ankle, and they did very well, which honestly surprised me because the arthritis was so bad in their ankles. You can use it on hips. I don't perform hip arthroscopy, so when we do this procedure, we always go inside the joint to look around as well. So I would recommend, if someone's going to have their hip done, to go to someone who does. It requires different instrumentation, et cetera, but it can be done in the hips as well, and there are a lot of doctors who do that. I just don't do that
hip.
particular surgery.
Now, am I holding it the right way? 'Cause
You
I'm
are.
like, oh, I
That's
was going to say,
perfect.
because this
Yeah.
could be upside down.
Yeah.
Somebody's like, what
So
kind of hip is that?
There's a ball and there's a socket,
Yeah.
and this just shows the areas most commonly where the problem results, and then where we fill the areas in.
And for those of you who are just tuning in here on Facebook. We are live with Dr. Pietropaoli of Victory Sports Medicine. This is a minimally invasive type of surgery, right,
Correct.
if you will, to help people with arthritic pain. Yes?
Yeah.
Yes.
Okay.
I love all these.
I have a question. Somebody actually asked this from a viewer. They're asking if people with who have dislocated knees, are they candidates for this sort of treatment?
All right, so they probably are talking more about like that their patella or their kneecap dislocates on them.
Okay,
So this is a knee.
Yep.
Here's the thigh bone, the femur.
Okay, yeah.
Here's the shin bone, the tibia. Then there's the kneecap, the patella. This is the fibula, but this is the main part of the knee. So if you actually have a dislocation of the knee, that would mean that these bones separate. That's a pretty bad injury.
Yeah.
Now, if you had that injury, you probably are more prone to getting arthritis down the road. So if you had arthritis, you certainly could be a candidate for the procedure. If your kneecaps are just popping out all the time, then you might need some type of a stabilization procedure of your kneecap. It depends on what that person's problem is. But having said that, we do, I've shown mostly the tibia or the shin bone being the bone that we inject into, which is the most common.
Okay.
But people get these bone marrow lesions in the femur, the thigh bone, and they get them in the patella, the kneecap. So I have done this procedure in all three areas, including the kneecap. And there are a certain percentage of patients who have a lot of this stress or this microfracturing, these lesions in the patella, and the surgery can help them. So, and they do have a little bit more pain after the surgery because it's a smaller bone you're injecting this into. But I have done it on the patella or the kneecap, yes.
Okay, good to know.
Now, you've been doing this since 2014, so it seems like a pretty much a newer procedure.
Correct.
Do other doctors around the country do the same thing, or can you get
Yes.
it? Yeah, okay.
Yeah, well, actually, Jeremy, how many doctors around the country are using this now?
It'd be very hard to estimate. But
So
it's becoming widely.
It's pretty common
Yeah.
nowadays. That
I mean, when I first started doing it, there had been 7,000 of these procedures done in the U.S. Now, I believe there's been over 100,000, maybe 200,000. It's between there. So there's hundreds of doctors who do this. There's not many around here, but there are hundreds of doctors who do it. So there's actually, I go around the country and help teach other doctors how to do it.
Okay.
And in a couple weeks, it's called the Master's Course. It's in Chicago. So a lot of the doctors who've been doing this procedure for many years, we all get together and we all share our experiences
notes,
so that we can, so we've evolved in how we do the surgery, how much of this we put in, because in the beginning, how much do you inject in? We don't really know. So now we kind of have an idea of how much to inject into each area. So it's evolving, but I mean, I used it on a patient who I really had no solutions for the first time, and he had a lot of that white signal throughout his bone, and he was very young, and he was too young for a knee replacement. He was still working, and he had a lot of pain. He'd seen a couple other doctors, and I'd heard about this procedure, but I had never performed it. So I told him, hey, there's a new procedure. You mind if I go get trained and try it on you? And he was fine with it, and he's done remarkably well. He's camera shy, so he wouldn't come on today, but he was the first one we ever did, and he had a pretty significant amount of this these bone marrow lesions in his bones.
Speaking of having something like this done, Gail, I know Beth, you mentioned Zumba. Gail, was there anything that you couldn't do before you had this procedure done?
I couldn't do anything. I was walking with a cane.
Really? Okay, that's good to know.
But you said you were a golfer before your knee started acting up, or
Right.
knees,
And now you're a golfer again, right?
Yes.
Yeah.
Yep.
Wow.
It kept me from doing anything. And I had both. On the left leg, it was the fibia. On the right leg, it was the tibia.
Okay.
But Doc, I thought I was the first.
You might be the first who we did two on. You might be. But you weren't the first, no. Sorry. I apologize.
It's all right. Well, listen, if you'd like to learn more about Victory Sports Medicine and how they can help you can find them. They are located in Skinny Atlas. Give us your phone number where they can contact you, Dr.
Yes,
Pietropaoli.
315-685-7544.
Yeah.
And we're also going to be doing a free seminar. I may be stealing your thunder.
No, this is your...
Free seminar at the Dinosaur Barbecue on July 31st. So if you go to our website or call the office, we can sign you up. There is limited space there and limited
It's
food.
at 6 p.m. and you can also pre-register victorysportsmedicine.com/knee repair if you'd like to register for that.
Because you get a free meal.
Cute.
You get a free meal. That's
It's
my
Dinosaur.
I love
Come on.
it.
I'm all about the discount.
Yeah, and I'm like, go for the education, the information, because if you really need this sort of treatment. No, because as somebody who's had surgery, it can be painful, but if there's a way to not do a full knee replacement, this is a big deal, right?
Absolutely.
Yeah.
And somebody who likes to eat.
That's
great stuff.
Thank you all so
kidding.
much. Thank you all for tuning in, everybody on
Thanks,
Facebook.
guys.
We'll see you tomorrow.
Have a great weekend. weekend.
Have a great weekend.